Hello, Dr. Buleni here, and today we're talking about dentures versus implants. So we normally do dentures or implants when you are missing a tooth. Let's say you've extracted a tooth, it's either immediately or you've had your teeth removed a while ago. And then we'll do either a denture, which is a false tooth that comes out, or an implant which stay fixed on your mouth. So an implant is whereby we screw in a screw and then fix up do a crown on top. That one is more like obviously it's a prosthesis, but this one is a fixed prosthesis, just like when you had an issue with your hip and then they'll put in a metal hip for you. So an implant is something like that, but it's a tooth one. So what we do is then, what I feel then is better is the implant, because it preserves the bone. It's more natural. It looks, you are able to clean it like your normal tooth. It feels natural. Obviously, it feels like the other teeth as well. Whereby a denture or a false teeth, you have to take it out. It's uncomfortable. It's always uncomfortable for your tongue because your tongue is not used to having something there in your mouth. But it all depends on you. I mean, if the denture is much cheaper compared to the implant, and then another thing is that when you when you do the dentures, just know that in the long run you might need to do an implant because it's really uncomfortable. So it all depends on you. The disadvantages of the dentures is that you have to remove it, and clean it separately, and the bond gets resolved, and you just have to make sure you clean it properly, and have to learn to eat with it because it's uncomfortable. It's a foreign body as well. You have to learn to eat with it and take it out, and the bone will resolve, and then you lose the bone. The nice thing about the implant is preserve the bone. It looks natural, it feels natural. You clean it like your normal tooth as well. But you just have to remember that just because it's there and it's an artificial tooth doesn't mean then you have to neglect it. You still need to floss your tooth, you still need to brush your tooth, you still need to use the interdental brush. The implants can last up to 20 years, and then the dentures up to 5 to 7 years, and you have to do new ones again. We also have implant supported over dentures. That's where we put in the implant and then we put the dentures on top of the implants to secure it. That one is to help with the cost in terms of not having to do multiple implants, but you can have just 4 implants and have a denture on top that is supported by the implant for stability. So, and also there are some indications and contraindications for people who can do implants. Not everybody can do them. If you are on certain medications or having certain diseases, we would not recommend that you do the implants, because obviously the body might reject, or it might not last that long. It might fail in the future. When you do a checkup with your dentist, they'll always advise which one is best for you. If you have any questions, please comment below, then I can be able to answer them in the next coming videos. Thank you. Bye.